Okay? Give you medication, okay, we're able to control your blood pressure to 120. That's normal. So upon further lifestyle intervention, upon further implementation of your lifestyle change, say for example, your blood pressure goes down to 100/70. That's quite low already. That's the time I start to remove the medication one by one. So we reduce the dose first. Once we reduce the dose, we remove slowly, one by one, until such time that you're off your medication completely. So what happens is throughout this journey, your blood parameters remain within normal range or probably slightly above. So you're still at low risk or normal, and you are starting to wean off your medication. Okay, so we do it safely. All right? So please, 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 if you are on your maintenance meds, don't just stop them outright, because me personally and my other colleagues, they have had their fair share of experience when patients suddenly stop their medication, blood pressure shot up, the patient had to go to the ER. Okay? So you don't want that to happen to you. So continue taking your medication and and follow up with your doctor, so your doctor can slowly wean you off them.
You know, my biggest takeaway from what you've shared, Doc, is that we can get off our maintenance meds. You don't have to be dependent on your maintenance meds. You can live a life free from maintenance medication. So that is really something you should look forward to, everyone who's diabetic. Yeah.
Okay, going to the next question from Facebook, Elena Robles Antonio. I have hypothyroidism. When I have my thyroidectomy last 2015, the doctor prescribed metformin and medicine for cholesterol, even though I am not diabetic during that time. I am taking rosuvastatin as maintenance, even though my cholesterol is not high. Why is that?
I have to ask how old you are. Also, metformin, okay. This is just a guess. No? I don't know what your doctor was thinking, but it seems that these two medications were used for off-label purposes. Meaning, the doctor is using them for secondary use of the medication, okay, for its secondary effects. So metformin, it lowers blood sugar levels, right? Metformin. How does it lower blood sugar level? By way of reducing insulin resistance. One of the side effects of metformin is weight loss. If you have hypothyroidism, the tendency is to gain weight, especially when you have had your thyroid removed. I would also think you should know that you will be on thyroid hormone medication, thyroid replacement therapy. All right? So I don't know how your weight is right now, or how high your blood sugar levels are, but the metformin, I think, is being prescribed for this purpose, for weight loss, to reduce insulin resistance. Those two. Now, for cholesterol, specifically rosuvastatin, another off-label use for anti-cholesterol medication is that they are plaque stabilizers. So if you are elderly, if you have had a history of blockages in your arteries, or there are evidences, no, of blockages or plaques building up inside your arteries, then low dose statins would be used for this purpose. Okay, so I don't know how high the dose of the rosuvastatin is, but I have had a number of patients who consulted me, no, wherein their cardiologist maintained them or on rosuvastatin or atorvastatin for this purpose, plaque stabilizer, so that the plaques inside your arteries don't get dislodged and go elsewhere and block the supply of blood to that part of the body. Because these embolizations, plaque embolization, you can suffer from a stroke from that. You can suffer from a heart attack from that. You can actually suffer from pulmonary embolization, difficulty of breathing because of that as well. So yeah, so that's another off-label use for the medication.
All right, I think that you have a very complete answer.
Yes, I hope that gives some clarification, ma'am. Okay, next question. Are there particular types of cancer that people with diabetes and hypertension should be more vigilant about?
Oh, that's interesting.
Yes, a lot, a lot.
Wow, that's interesting question.
Yes, breast cancer, pancreatic, liver cancer, colorectal cancer, prostate cancer.
Wow, Doc, among the cancers you
These five.
mentioned, the pancreatic and the liver cancer, these are two very lethal, very painful, very fast and acute
Yeah.
cancers. So it's
Yeah.
really important to get your diabetes under control.
Yes. In fact, I just saw a patient a while ago. This patient developed liver cancer. The liver cancer developed because of fatty liver disease that was left untreated.
Wow.
Yeah, I won't disclose any further information, but I leave it at that. So fatty liver disease can develop into liver cancer. Okay. So how does
Wow.
this happen? Yeah, a simple disease, right? Developing into a very
That's so scary.
um dangerous
A very dangerous
disease.
condition. Yeah.
Yeah. So fatty liver disease, how does this come about? Okay. So with its name, fatty liver, it's basically liver that is full of fats. Where did the fat come from? It's from excess fat intake. How did excess fat intake happen? So it's from eating fried foods, oily foods, high fat foods. Aside from that, high sugar foods as well. Because sugar, excess sugar, will be turned to fat. Okay. And your body will deposit that to your fat tissues. That's why we gain weight. Okay. We develop stomach. Okay. And the liver is also one organ where the body stores the fat. Okay. So if that happens, okay, and it was left untreated, the liver will get inflamed. If it gets inflamed, it will develop into cirrhosis. It will develop scarring. So when the scarring becomes diffuse, you will develop liver cirrhosis. Liver cirrhosis is where that is the point of no return already. So I just want to let all of you know, no, the liver is an organ that regenerates very fast. But with repeated damage, it can get scarred as well. And when it gets scarred, it will develop into cirrhosis. That's the point wherein it's not reversible already. And when you have liver cirrhosis, the parts of the liver that is cirrhotic can develop into liver cancer later on. Okay? And this is, mind you, this is in patients who are not drinking alcohol.
Wow.
Okay? Yeah.
Wow.
So it's just basically from a very bad diet.
Wow. Okay. So I mean, Doc, we know that our diets can lead to cancer, but this is something. Yeah, because many times people ask you, like, can a benign tumor become cancerous, a myoma become cancerous? For most of these cases, your answer has always been no. It's different. But to hear that, just a fatty liver can develop into cancer, that brings it very close to everyone that's listening. Wow. Thank you for that. That's like a huge warning. So what about diabetes? Diabetes contributes easily. I mean, it's linked to like how you end up with a fatty liver. So that's again a direct line from diabetes to cancer.
Yes. So here's what's gonna happen, though. So when you have diabetes, so you already have insulin resistance, most likely you'll develop fatty liver. Okay. So now with diabetes, with the insulin resistance, your body's gonna pump a lot of insulin. So your insulin is gonna be very, very high. And insulin is a hormone that makes things grow. Okay. So if you have a tumor and you have very high insulin, that insulin will make the tumor grow. Okay. So how were they able to prove such a thing? So among diabetic patients, they divided those who are taking insulin shots versus those who are not. Then they measured, they counted the number of patients who are on insulin shots and who are not on insulin shots, how many of them develop cancer. And they saw that patients who are on insulin shots, they develop cancer more frequently compared to those who don't. Okay, so patients who inject exogenous insulin. So it's basically helping your pancreas secrete more insulin by injecting more. Okay? So basically you're pumping a lot and lots of insulin inside your body. And with the ongoing inflammation inside you, the DNA damage, the repeated damage and repair that's going on, you can develop tumors from this. Okay, so when you develop the tumor with very high insulin levels, that will contribute to the growth of that cancer. Okay, and since you are diabetic, your blood sugar is gonna be high. That sugar will also fuel the growth of that cancer. Okay, so that's how diabetes contributes to cancer growth. So on top of that, no, if you are diabetic, most often than not, your diet is gonna be crap as well. So the food that you're eating is also gonna contribute to the growth of the cancer, because there are foods that are carcinogenic, like processed meat. Okay, sausages, no, corn, beef, corn, tuna, hot dogs, no, dried seafood. So these are carcinogenic. Okay, so that's gonna also contribute to the growth of the cancer. The way you cook your food as well. So if you are fond of grilled foods, if you are fond of fried foods, those are carcinogenic as well. So that's gonna contribute to the growth of the cancer. So that's how things are linked, no, interlinked with one another.
So it's really important for cancer patients not to become diabetic as well. So for a
Yes.
cancer patient, you got to manage your blood sugar levels. So again, for everyone out there, since we do talk about cancer so often, that's another reason why taking PPAR extracts and PPAR tablets are so good, because you are taking PPARs for your cancer, but PPAR tablets are what we use, Dr. Jansen as well, to help patients manage their blood sugar and metabolic syndromes. So in real essence, you are killing two birds with one stone. So that is why, again, why PPARS is such an amazing and wonderful basic supplements for those of you who have metabolic syndromes and cancer patients as well.
Okay, I think they're getting scared now, because the next question
Getting
is,
scared.
how often should individuals with diabetes and hypertension get screened for cancer? And what types of screenings are recommended?
Oh, that's good. Doc, you've
Yeah. Okay.
imparted knowledge to them, so now they are acting on
Very
the
good
knowledge.
question.
Yes, all right.
Yes, I like the way they are asking questions. So it shows that they're listening well and they're thinking.
Okay.
So now with this, no, if you are diabetic, you have to be more vigilant. Okay. However, still, no, with the guidelines, the consensus is, if you have these diseases, you still follow the guidelines for regular individuals who do not have family history of cancer. So example, if you are someone who don't have a family history of cancer, you want to get screened for breast cancer, you start at age 45. Yeah, 45. That's when you start to undergo breast ultrasound, annual mammogram. Okay? For your colorectal cancer, start at age 50. Okay? So that's gonna be once every 10 years, no, if you don't have a family history of colorectal cancer. These numbers will change if you have a family history of cancer. So we typically screen earlier on. Okay? However, if you go for a consult with me, okay, what I will recommend is the regular screening tests, no. Of course, we will still follow the guidelines, but I will add ctDNA testing. ctDNA is circulating tumor DNA. Okay, so this is basically detecting any cancer cells that are circulating around your body that has mutations that are very high risk for developing tumors. Okay, so one test that we can do is the spot mass test. Spot mass is a test being done by Gene Solutions. Gene Solutions is a Vietnamese biotech company, and they're really very good in testing these sort of things. No? They've done 1 million tests, so their tests are really reliable. So the cancer types that we can get screened for are your breast cancer, lung cancer, ovarian, liver, and gastric stomach cancer. So these 5. Okay. Yeah. There are other tests that we can get that we can do. So like for colorectal cancer, we can also screen for that. Okay. But it is only by getting 10 ml of your blood. That's it. That's for screening.
Wow,
Yeah.
okay, great. So you all got your advice, and for me, I'm 50, turning 50 in a month. I have to get my prostate examination. Not looking forward to that. All right. Okay. Next question,
Okay. We're almost at the end of the webinar. This will be our last 2 questions for tonight. First, from Reggie Valenzuela. Does diabetes lead to CKD?
Oh, yes.
Definitely.
Yes. Oh, definitely. There are a lot of risk factors for developing chronic kidney disease. The number 1 is hypertension. Number 2 is diabetes. Okay, so definitely, no, definitely. So how does diabetes cause kidney
Yes,
damage?
please let us know.
So remember, in diabetes, you have high blood sugar level. So if your blood sugar is consistently very high, the sugar molecules will damage the endothelium. The endothelium is the inner lining of your vessels, of your blood vessel. Okay? So inside the kidney, if you look at it under the microscope, you have a tube. I'll call it pipe. I call it pipe. So you have a pipe going into the filter, which is the glomerulus, and you have another pipe that goes out, no, of the glomerulus. Then you have a third pipe that forms the urine going into your bladder. Okay, so these the blood vessel, the pipes that goes into and out of your glomerulus, that can get damaged. Okay, because of high blood sugar, it will stiffen. The filter itself, your sugar glucose molecules goes inside that filter. Okay, the filter is the glomerulus is also filtering the blood sugar, so you don't pee out your sugar. Okay, so now when you have diabetes, meaning your blood sugar is very high, the sugar molecules will force themselves um inside your glomerulus. So imagine this, no, imagine this. You have your water filter. Okay, you have your water filter. The typical water filter filters out what? Sand, dirt, right? So that you get clean drinking water. However, if it rains, if it floods, then the water going into the filtering system will be full of mud and sand. Guess what? If the water pressure is very high, the water pressure is gonna force those sand particles, those mud particles through the filter. What will happen to the filter? If your filter is this big, okay? If your filter, for example, is this big, the sand molecule is this big, so it cannot initially pass through. It won't be able to pass through, right? However, if you force them, guess what? The filtering system will enlarge because of the high pressure. It will enlarge and force the sugar molecules, no, the sand, the mud, no, will be forced through the filtering system. And the kidneys filtering system, if it gets damaged, it's very difficult to heal them. Okay, it's very difficult to heal them. So in other words, if the filtering system goes from this to this, it's gonna be very difficult for it to go back to this. Okay, so your blood sugar, your sugar will spill out of your urine. So that's also one sign of diabetes. Okay, and if it repeatedly happens, even your protein will go out of your urine. If your protein goes out of your urine, that's a sign of CKD already, chronic kidney disease. All right. So another one is inflammation. Okay. Patients who have diabetes, they're in a status wherein they are on a constant they are experiencing constant low grade inflammation. Okay, they don't feel any pain, but inflammation is there. So the inflammation will also damage the kidneys. It will damage the filtering system as well. Okay? And when inflammation damages the filtering system, that system will also scar itself. Okay? So that's why for some of you, probably you have had experience before, if you have heard with somebody else, there is something that we call medically as glomerulosclerosis. Glomerulo is the root word for glomerulus. So that's the medical term for the filter of the kidney. Okay? Sclerosis is the medical term for scarring. Okay? So glomerulosclerosis is scarred glomerulus. So that's your kidneys getting damaged, because of the inflammation. It's also at the point of no return. You won't be able to reverse glomerulosclerosis
Wow.
anymore.
Wow.
Okay?
So it's so clear. Diabetes can destroy, accelerate, and contribute so directly to the destruction of your kidneys. And for everyone, if your kidneys are destroyed, they cannot be repaired. It cannot be regenerated. Just now Dr. Jansen talked about fatty liver. Liver cirrhosis is also very serious, but the liver is an amazing organ. You can cut half of your liver away, it will grow back, right? So the important thing is just don't develop full liver cirrhosis. But any other damage to the liver can actually be regenerated. The kidney is not such an organ. If it's destroyed, it's destroyed. And Doc, I remember one conversation that I learned from you that was so shocking to me, is that we always think, right, if when you get cancer, I have 5 years to live, only a limited time. I never knew that when you went onto dialysis, your lifespan is also cut very dramatically. Many people on dialysis don't live past 5 years or not much more than that. Of course, there are others who continue to live long, but there is actually a high probability that your lifespan will be cut short. So don't ignore diabetes and kidney failure. It's actually lethal, almost just as lethal and impactful as cancer. And cancer is expensive. So is kidney failure, right, Doc? Dialysis is not cheap.
Yes. Actually, dialysis or having CKD, if you're dependent on dialysis, for me, it's worse than cancer because for cancer, if you go into chemotherapy, radiation therapy, there's a fixed number of sessions.
Yes.
Right?
Yeah.
You only go through 8 cycles, 6 cycles, 12 cycles of chemo, or 25, 30 sessions of radiation therapy, then that's it. For dialysis, no, it's for life. Let's imagine. It's for life. You'll be dependent on the machine to clean your blood. If you don't undergo dialysis, you will die, and you will die, a few days time. So it's really bad, no? It's really bad. It's one of the diseases that is quite debilitating for the patient and also for the family who's taking care of the patient.
Yes. So even though it's less scary in general, because when anybody hears I got cancer, they're so scared. But I am at risk of kidney failure. Somehow they just think I will survive. But that's actually not the truth. The truth is it's financially very draining, and your lifespan can be cut to as short as 5 years. So don't ignore diabetes, huh? Don't ignore diabetes. If you need a consult Dr. Jansen. If you're on maintenance meds, have a consult with Dr. Jansen. He'll have a protocol to help you get off your maintenance meds and get you back into the pink of health. Yeah.
I hope that serves as a wake-up call for everybody.
Yes, everyone.
Next question. Can PPARS help with CKD?
Yep.
Yep.
Yes.
The short answer is
definitely.
yes. From my point of view, is from my angle is because PPARS works on many of the root causes for CKD, from inflammation to blood sugar levels, to your general health in terms of cell delineation. So your blood, everything, your cells are being repaired correctly. Yeah, so many levels. But Doc, you have any specific root causes or how PPAR helps with the prevention of CKD?
Yeah, PPARS has very strong anti-inflammatory properties, characteristics. Polyphenols, they are polyphenols. Okay, so with this, you can immediately combat the low-grade inflammation that's going on inside the body of the patient. Another one is PPAR agonists can help improve insulin sensitivity. Okay, so with this, no, you also improve your sugar metabolism. Another benefit of another way, no, how PPAR agonists do this is it lowers cholesterol level, it lowers triglyceride levels as well. So basically what happens is it improves fatty acid metabolism. Okay? So with this, you immediately address one major risk factor for the development of CKD and the worsening of CKD, which is diabetes. Okay? So that's the benefit, that's the main role of PPAR agonist, no, for CKD patients. Yeah.
Okay, at least that gives us some hope against. Okay, last question again from Miss Elena Robles Antonio. Is it true that my thyroidectomy last 2015 is related with my breast cancer this 2024?
Good question.
Having your thyroid removed is not a risk factor for the development of breast cancer. However, if you are overweight or obese, having a very high weight, no, is a risk factor for the development of breast cancer. However, it's very seldom for us to get obesity, being overweight, no, after a thyroidectomy if you regularly go see your doctor, and if you are not obese or overweight in the first place before you got into the surgery. However, if you are already overweight or obese, no, when you got into the surgery, then the surgery doesn't have anything to do with the breast cancer developing at all. It's because of it's because of being overweight in the first place. Okay, so I think that might be the one that contributed to the development of the breast cancer. Not really because we removed your thyroid. Yeah. Okay.
All right, it looks like we've covered all our questions. So just before we say goodbye, can't you give our viewers your parting words for tonight?
Dr. Jansen, you want to start?
Yeah, so I just want to thank all of you, no, for listening to us. The questions are very interesting, no, tonight. It shows that you are really listening and you're really thinking. Okay, it makes us happy because we by knowing so, no, we feel that all our efforts are really making a significant impact to you guys, which is really the most important goal of this program of ours, no? So keep asking those questions so you guys learn, other patients learn as well, and we also learn from you. Okay, so thank you everyone for listening, and I hope you learned a lot in tonight's discussion. So I'll give the floor to Shyan.
Yeah, tonight our topic is diabetes, something less serious than what we usually talk about, which is about usually cancer. But you know, I'm sure everybody also benefited tonight to know that something as innocent and generally accepted like diabetes, like it's a kind of illness many people have, but yet it could lead to very serious situations like kidney failure and you know and liver. It affects your liver health, and that can actually develop into liver cancer, which is one of the most painful and difficult cancers to treat. So my last parting words is that diabetes is actually the top, usually about #3 killer in most developed countries and developing countries. So it's so common, but yet it also kills many people. So don't ignore diabetes. The good news is that diabetes can be easily managed and even treated with PPAR tablets. We don't even need to go to the extracts, especially if you're borderline case. So the moment you're slightly high in blood sugar level, please, you know, type our staff, our HCS, healthcare specialists, and like CSOs like Ms. Jhen, who's a pharmacist, will be there to assist you. Really get your diabetes under control. And then at the same time, you will also get your other metabolic syndromes clear. So it's your hypertension, your blood cholesterol, all these will start to be managed and normalized in as short as 1 month to 3 months. And then you don't have to worry cancer coming up through this channel of diabetes and kidney failure and liver cirrhosis. All right. So with that, oh wait, someone said interesting to hear the doctors talk. Okay. We welcome and we look forward to meeting you again next week. So I'll hand the time back to Jhen. Thank you very much, everyone.
Thank you, Sir Shyan and Dr. Jansen. Okay. If you have any follow-up questions, don't worry. We will answer each of your questions next webinar or via direct message. And we hope to see you again in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. Next week, we will discuss how to elevate your chances of survival from colon cancer. In the meantime, enjoy Lazada 88 Sobrang Sulit Tipid Sale on Cleansing Plus, PPARS tablets, and soft gel capsule up to 26% off until August 12, Monday. And also, congratulations to the raffle winners earlier, namely Mary Hirayama, Jocelyn Carretero, and Amber Castro. Okay, so thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night and God bless you all.
Boost your health today with a Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS tablet for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Now is the best time to try our Simply Nature products. Available on our official Shopee, Lazada flagship store, our website www.simplynature.asia, and our office in BGC Taguig. Order yours today. Click the link on the description box.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.